Welcome to Clover Cure. Are you concerned about diabetes? Or perhaps wondering if some vague symptoms you've been feeling are actually warning flags? You're not alone. According to the International Diabetes Federation, more than 500 million adults worldwide are living with diabetes, and millions more are marching toward it without even realizing. Type 2 diabetes in particular can sneak up quietly, damaging blood vessels, nerves, eyes, and kidneys long before a formal diagnosis. The good news is that the body usually whispers warnings long before irreversible damage sets in if we know how to listen. Before we move into the list, remember that diabetes doesn't happen overnight. It's a continuum that often starts with mild insulin resistance, progresses to prediabetes, and only then crosses the threshold into a diagnosable condition. By paying attention to the signals your body sends early, you can often turn the tide completely. In fact, the Centers for Disease Control and Prevention estimates that more than 1/3 of American adults, about 98 million people, are currently living with prediabetes yet experience few, if any, obvious symptoms. Today we'll focus on 5 of the clearest early warning signs and what they really mean. Warning sign 1: excessive thirst and frequent urination. Picture this. You refill your glass of water again and again, yet your mouth still feels desert dry. Minutes later, you're heading back to the restroom again. Excessive thirst, known medically as polydipsia, and frequent urination, called polyuria, are two sides of the same metabolic coin. When blood glucose climbs above roughly 180 milligrams per deciliter, the kidneys can't reabsorb all that sugar, so they dump the excess into urine. Sugar drags water molecules with it through osmosis, filling your bladder more quickly and demanding extra trips to the bathroom. In everyday life, this can feel like an annoying loop, sipping water constantly, waking up multiple times at night to urinate, or planning your errands around restroom availability. It's easy to blame coffee, cold weather, or a small bladder, yet together these two symptoms are among the most classic red flags of developing diabetes. If you notice they persist for more than a few days, especially in combination, consider requesting a fasting plasma glucose or A1C test from your doctor. Warning sign 2: unexplained fatigue and brain fog. We all feel tired after a late night or an intense gym session, but diabetic fatigue is different. Glucose is supposed to be the body's primary fuel. Insulin acts like a key unlocking cells so sugar can enter and be burned for energy. When insulin is insufficient or cells become resistant to its signal, glucose remains stuck in the bloodstream instead of powering muscles and organs. It's like having a fully charged phone you can't switch on. People on the path toward diabetes often describe a heavy, lead blanket exhaustion that no amount of coffee cures, coupled with fuzzy thinking or difficulty concentrating. Tasks that once felt simple, writing an email, finishing a workout, even holding a conversation, can suddenly feel monumental. Because tiredness is such a common complaint, it's frequently brushed off as stress or aging, yet persistent fatigue paired with other signs on this list should prompt a closer look at blood sugar dynamics. Warning sign 3: sudden or unexplained weight changes. Diabetes can cause weight to swing in either direction, though unexplained weight loss is the classic early presentation, especially in younger adults developing type 1 diabetes. When cells can't access glucose, the body breaks down fat and muscle to meet energy demands, shedding pounds even when appetite remains high. Conversely, insulin resistance often leads to weight gain, particularly around the abdomen, because excess circulating insulin signals the body to store more fat. The key word here is unexplained. If your eating habits and exercise routine haven't changed, but the scale is moving by more than a few pounds either way over a short period, it's worth exploring whether fluctuating insulin and glucose levels are involved. Keep a simple journal of meals, physical activity, and weekly weight. Patterns provide valuable clues both for you and for your healthcare provider. Combining this data with a straightforward blood test can help differentiate between ordinary weight fluctuation and a metabolic warning sign. Warning sign 4: blurred vision and slow healing wounds. High blood glucose is surprisingly toxic to the fine vessels that nourish eyes, skin, and extremities. Excess sugar causes the lens of the eye to swell, altering its ability to focus light. The result is intermittent blurred or double vision that may come and go throughout the day. Many people notice they need to squint at a computer screen or hold their phone farther away, assuming they just need a new prescription, when in reality microvascular changes from fluctuating glucose are to blame. Similarly, tiny blood vessels in the skin and capillaries feeding nerves can become stiff and narrow. Cuts, scrapes, or even minor insect bites take longer than usual to close up. Bruises linger, and infections crop up more easily. If you find yourself stocking up on bandages or antibiotic ointment more often, or if your optometrist notes rapid vision changes, consider diabetes as a root cause. Warning sign 5: tingling, numbness, or darkened skin patches. The last early warning sign actually comes in 2 flavors: neuropathic tingling and acanthosis nigricans. Chronically elevated glucose gradually damages peripheral nerves, producing pins and needles sensations, burning pain, or numbness in the hands, feet, and legs. These feelings can start subtly, maybe just at night or after sitting for long periods, but over months they can progress to constant discomfort or loss of sensation, raising the risk of unnoticed injuries. Acanthosis nigricans is a skin change where folds of the neck, armpits, or groin darken and become velvety. It arises when insulin levels are chronically high, stimulating skin cells to reproduce faster and pile up pigment. While harmless in itself, this complexion hint is one of the earliest outward markers of insulin resistance in both adults and children. Either neuropathic tingling or unusual dark patches should spark a conversation with your healthcare provider about checking fasting insulin, blood glucose, and A1C levels. Catching neuropathy at the tingle stage gives you the best chance to halt or even reverse nerve damage. A quick note here: these 5 signs aren't the only clues. Other early hints include frequent yeast infections, recurrent gum disease, and elevated blood pressure readings. However, the 5 we've explored today are the ones most commonly reported in large clinical studies and the easiest to spot without specialized equipment. Each of these 5 early warning signs, excessive thirst and urination, unexplained fatigue, sudden weight changes, blurred vision with slow-healing wounds, and tingling or darkened skin, can occur individually for reasons unrelated to diabetes. Dehydration, sleep deprivation, hormonal shifts, or even eczema might mimic aspects of what we've discussed. What elevates concern is the pattern: 2 or more of these signs appearing together, persisting for weeks, or gradually intensifying. Here are some suggestions. First, take the time to track your symptoms. Use a simple notebook or an app to log daily fluid intake, restroom frequency, energy levels, weight, and any unusual sensations in your hands or feet. Patterns become clear much faster on paper than in memory. Second, schedule basic lab work. Ask your healthcare provider for a fasting glucose test, an A1C, and, if possible, a fasting insulin level. These inexpensive tests provide a snapshot of both current and 3-month average blood sugar, as well as how hard your pancreas is working. Third, prioritize lifestyle tweaks. While you wait for results, adopt small but potent habits shown to improve insulin sensitivity. 30 minutes of brisk walking most days, swapping sugary drinks for water or unsweetened tea, and filling half your plate with non-starchy vegetables. Even modest changes can drop fasting glucose by several points within weeks. Ignoring these early signals can allow prediabetes to progress silently into full-blown diabetes. Conversely, catching issues early often means they're still reversible. The landmark diabetes prevention program showed that losing just 5 to 7% of body weight and exercising 150 minutes a week cut the progression from prediabetes to diabetes by 58%. Beyond statistics, think about quality of life. Maintaining steady energy, clear vision, intact nerves, and freedom from daily glucose monitoring or complex medication regimens. Finally, if lifestyle changes feel overwhelming, start with one tiny step that fits your reality. Maybe adding a 10-minute walk after dinner, or swapping out soda at lunch. Small, consistent actions compound into big metabolic wins. If any of the signs we covered resonate with you, don't panic, but don't delay either. Make an appointment with a trusted healthcare professional, bring your symptom log, and discuss a plan. If your labs come back normal, fantastic, you've gained peace of mind and useful baseline data. If they show elevated glucose or insulin resistance, Remember that early intervention can rewrite your health trajectory. Thank you for watching. If you found this information valuable, give the video a like so more people can spot these early warning signs before diabetes takes hold. Subscribe and share this content.